Substance. Uncontrolled Substance.
Welcome to Uncontrolled Substance with your host, Dr. Cozzette Lyons-Jones, Chief of Adult Medicine for the Watts Healthcare Corporation.
Uncontrolled Substance.
Welcome to Uncontrolled Substance for the month of November 2021 with your host, Dr. Cozzette. And back in the studio is none other than Mr. Noel Jones.
What's up? What's up?
Oh, God, you're so ghetto. Anyway, I'm so happy to have him back in for this particular month, which is Alzheimer's Awareness, National Alzheimer's Disease Awareness Month for 2021. The proclamation went out by President Biden. And I'm, happy to be able to bring this because this is a hard work for me. I've had two family members with dementia, my mother and my grandmother, my mother's mother, and watched when I didn't understand the disease, the progression in their lives. And as I, went through training and things and became more aware, I could identify earlier signs that I wasn't aware of back when I was a kid. But Alzheimer's is the seventh leading cause of death in the U.S., and it's the fourth leading cause of death in California, which is where we are. There are 5.8 million Americans with the disease, and more live here in California than in any other state. The California Governor's Task Force on Alzheimer's noted between 2000 and 2017, deaths due to Alzheimer's rose 145%.
Wow.
Yeah. Now, our show has been a platform for shining light on the public health and health disparities issues, and Alzheimer's disease falls on our long list of issues that we believe is important to discuss. Every 65 seconds, a person in America develops Alzheimer's disease. 2/3 of Americans with Alzheimer's and their unpaid caregivers are women. A woman in her 60s is twice as likely to get Alzheimer's versus breast cancer, yet women are underrepresented in research trials. And shout out to Maria Shriver and the Women's Alzheimer's Network for shining light on that and going hard in the paint for, getting the money to fund research efforts for not only women, but also women of color. Older blacks are twice as likely to develop Alzheimer's versus whites, and Latinx are 1.5 times as likely. Blacks have 1.7 times more likely, more hospital care costs, in part due to presenting or being diagnosed at later stages of the disease.
Wow.
People of color is less likely to be correctly diagnosed in a timely manner. The disparity is due to systemic and structural racism at the root, with a higher prevalence of conditions that are risk factors for the disease seen among black and brown communities. So I wanted to, put that out there and kind of introduce it. When you talk about dementia actually is a symptom. It's a group of symptoms. It's not a disease itself because there's many different causes of dementia. When you talk about dementia, it is a disease, or Alzheimer's dementia in particular, that is the most common cause of dementia. So it causes between 60 to 80% of all the cases of dementia that are out there. But you can have vascular dementia. So say if you have a person that have little mini strokes or even a major stroke, but little mini strokes. So you may not have lost your speech or your ability to walk, but over time, it may manifest in memory impairment. There's Lewy body dementia. There's, a lot of different, less commonly known forms of dementia, but the most common one that causes dementia is Alzheimer's. And when you talk about Alzheimer's, you can have Alzheimer's disease without dementia, meaning 20 years before you even get impairment in your memory being manifested, you actually have the abnormalities, the abnormal proteins being deposited in your brain. And that's scary.
That's very scary.
It's like right now, we're sitting here talking, but a decade from now, we may start to manifest things that are already in progress.
That's so scary. I think that's why people don't like to talk about it.
Yeah, but we got to talk about the things.
We got to talk about it.
Yeah, got to talk about it, man.
Absolutely.
Because there's power in knowledge, and you can change things. There are modifiable risk factors for Alzheimer's dementia because it's the many of the things that are risk factors for Alzheimer's is also risk factors for cardiovascular disease. So if you control things like your weight, control your blood pressure, your diet, have a healthier diet, stay connected socially, with people. If you stop smoking, if you're a smoker still, all of these things are modifiable risk factors. You can't modify your age. If you're blessed to age, that is going to be your risk factor. Family history could be a risk factor as well. And then there could be a genetic predisposition in some persons, especially if you notice family members who are presenting earlier than, typically seen. So these are some of the things that we, need to kind of, put out there. There are stages to this, and it's the long walk is what I call it. I can't stand it. When I have patients that come in and I see what's happening, I know that walk, that journey for that individual and the community that's connected to them, it's going to be long. And it takes years. It's not, like some other diseases where, you get diagnosed and then, there's a quick progression.
That's right.
This is a slow, progressive condition. And it's not normal to not remember how to balance your checkbook. Now, you may make some mistakes as you get older, balancing your checkbook, but it's not normal to lose the ability to execute that particular task fully. There are certain things that we attribute as normal that are abnormal. And certain things that we look at and say, oh, that's just, normal aging, stuff. She's older, that's what they do. But it's not normal to wander and get lost and not remember where you are, in a area that you've lived in for years. So these are some of the things that we want to, put out there for our listeners.
That's right.
And to think about Alzheimer's as a spectrum. There's preclinical symptoms where you have abnormalities, abnormal changes and chronic inflammatory things that are going on in the brain years before you actually manifest any changes in memory or learning or language. So that's preclinical where you're asymptomatic. And then there's mild clinical or mild cognitive impairment or MCI, which can be secondary to Alzheimer's, where you're still okay but doing your everyday activities of daily living, but then as it progresses you go through mild, moderate, and severe. It's important to recognize that it's a spectrum, and where you are now at the time of diagnosis, or where an individual is at the time of diagnosis as far as their symptoms, is not where they're going to stay. And so I bring that up so that families and communities that are dealing with loved ones who have the diagnosis of dementia, whether it's of Alzheimer's or other types, but particularly of Alzheimer's, which is what we're talking about today, that you consider your plan as far as estate planning or caregiving needs and things at the different stages, because your needs are going to become more intense. You're going to need more of your village to come in and support you as time goes on. How do you feel about that? I know you really feel heavy on this topic.
This is a tough topic. However, it was such an eye-opening topic doing the research in because I had just completely not wanted to think about this. And the reason is why I think about it. Who knows what's going to happen? How do I change anything even? So, but I am so glad we're talking about this. From the research we talked about, we looked at, trying to know yourself, I think, and be an advocate for your own brain health is very, very important. One of the things I think is that people don't see that slow decline sometimes. And then you do see it when things are getting toward moderate defects. But do little things like puzzles. And I know we're getting into the prescription perhaps, but how do you stay up with where you are? Hopefully it doesn't happen to you. There's a great chance it won't. But how do you know? I'm going to start doing puzzles again.
Yeah.
just so I can see when I start to decline, things of that nature. But what a subject. The only other thing I'd want to say before you jump back into it is, I know that, and you may talk about this, President Biden is putting more money out there
Oh, yeah.
for Alzheimer's and dementia, but it doesn't even seem close. And when you look at AIDS funding, and we don't need to take money away from AIDS, we need to add money to these other problems.
Right.
But $6 billion in 2019. What we've looked at here that's coming from this proclamation is a drop in the bucket.
Yeah, yeah. The economic toll is significant. African Americans are bearing a huge brunt of that financially, and it's mostly in the area of trying to get caregiver support. And when you think about the American Rescue Plan, it invested $145 million to help caregivers provide for their loved ones. Here in California, you have Governor Newsom, who also has a heart for this, but he earmarked $32.5 million towards Alzheimer's in the state's budget for 2022. Now, you may say, well, that's nice. That's, they're putting money towards it. It really is a drop in the bucket when you look at the economic toll that can get up into the trillions of this disease. And like you said, we got to do more. Where you're going to find the dollars, someone may say, that's a whole nother conversation. But there is something to be said about looking at the untapped resources in terms of caregivers who are unpaid caregivers of these patients, who you could train up and make them viable beyond their families to be able to enter into the workforce. And that's people of color.
Indeed.
A good majority of those are people of color and women. So to be able to go in and to, look at the structure and the training of people through in-home supportive services, for example, to be able to coach them up, train them up, and equip them in a way that they become more viable, that they give even better care to their loved ones and are able to get a job outside of the home, and to even look at ways of being able to embed financial incentives for people to go into this area. There's things that we can do to generate the money, as opposed to just saying, okay, you need to give the money and not really know where that money is coming from, right? Because I know how you are.
Well, I'll be honest. In-home care, I've seen quite a bit of abuse and fraud in terms of that. I've heard some of my employees talking about it. But at the same time, there's a wave coming, and Alzheimer's is a wave. It's the forgotten pandemic, so it's a wave we don't even look at. But as the baby boomers age, there's a wave of just people who are going to need care, whether it's Alzheimer's or whatever.
Yeah.
So if there's a pipeline for women and people of color to get that training, to do it for their own families, but then be able to use that training for the greater society,
Right.
then it's an investment.
Hold that thought. We got to pay the bills. But this is good. I like. We're going to go into the waiting room in the next segment, but I want you all to hold tight. We'll be back in one moment on Uncontrolled Substance. This is episode 17, The Forgotten Pandemic on Alzheimer's Disease in the Black Community. Stay tuned to the Real Urban Radio Network.
Uncontrolled Substance.
Hi, family. Join me, Prophetess Denise Anderson, every Sunday at 3 p.m. Pacific Standard Time for the Power of Prayer Show. We'll be talking about the different innovative ways of why people can't get a prayer through and how to get a prayer through. Is your lifestyle lining up with your prayer life? Join me for the Power of Prayer Show every Sunday at 3 p.m. Pacific Standard Time on the Real Urban Radio Network app and on realurbanradio.com.
Uncontrolled Substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette and My love, Mr. Noel Jones.
Yes, yes.
Yes, we are in the waiting room. Sick of this doctor. She's always late, right? Always. But I did notice like 3 patients coming in like an hour late for their appointment. So that probably has something to do with it too.
Oh,
but anyway,
man.
we're going to entertain ourselves and kind of catch up on the news.
I got you. And let's just jump right into it.
Yeah.
ABC News on November 17th. This is a big one because it deals with what you like to call the twindemic possibility.
Yeah.
Campus flu outbreak climbs over 500 cases, and state health department raises alarm. Public health officials are investigating an influenza outbreak at a Michigan university that has resulted in more than 500 cases, as several schools have also seen surges in flu activity. The University of Michigan's Ann Arbor campus has reported over 525 cases among students since October 6th, and about 3/4 of them were unvaccinated against the flu. Other campuses are also battling flu outbreaks. Rowan University in Glassboro, New Jersey, has logged 150 flu cases.
Wow.
And spikes in flu cases have also been seen at Florida State University and Florida A&M University, the Associated Press reported earlier this month.
So that's a nice plug for please get vaccinated, get the flu vaccine. I know we've been, talking about the COVID vaccine and,
Yep.
Dealing with that, which, we can give some updates on that. But we can't forget that the flu is still sitting there.
That's right.
The potential is there for a twindemic. So please get your vaccines.
And again, both the flu shot and COVID vaccine, they can be taken together, right?
Yes, they can.
All right. So you don't have to keep going back.
Nope.
Just get them together.
Yep.
Moving on to COVID boosters, the Washington Post, and I'm going to put both of these together, Washington Post and the Atlantic article. While federal officials continue to limit who can receive a coronavirus booster shot, a growing number of governors from both political parties and other officials are circumventing the guidance to offer boosters to anyone over 18 in hopes of staving off a spike in cases over the holidays. California made the first move to expand access when public health officials quietly sent a letter to local health jurisdictions and vaccine providers on November 9th, instructing them to trust patients to decide whether a booster is appropriate. Do not turn a patient away who is requesting a booster if the patient is 18 or older and has waited the required period after their first vaccination series, the letter said. Within days, officials in Colorado, New Mexico, Arkansas, West Virginia, and New York City endorsed boosters for all adults. By Wednesday, several more states had expanded booster eligibility to all fully vaccinated adults, including Kansas, Maine, Rhode Island, and Louisiana. What do you think about that?
California is walking the walk.
Yeah, we're the leader.
In this instance, I do agree. I think we have taken, it's kind of the other side of the pandemic. First we were saying you have to, wear your mask. You have to stay home. You have, and now we're saying, enough. You know yourself. Please. Go ahead and get the vaccine. Yeah. So this is the other side of that. So we can debate on that offline. Yeah. However, I agree with it. I can make a case for almost anybody to get a booster vaccine.
Absolutely. You've been making that case.
Yes. Yeah. I mean, if you look at the list of conditions on the CDC website, obesity and being overweight is listed there.
Yeah.
Mental health is there. Chronic kidney disease, not dialysis patients, but people who may have early stage with normal functioning kidneys still is on that list. So, I mean, there's an exhaustive list of obvious things, like cancer and immunocompromised states and things, but these other like overweight and obesity, I'm like, what if you have nothing else? Yeah. But it's on the list. So you can make an argument for almost anybody to get it. And this protects the spread of the disease in the community, and it also helps to mitigate the chances of mutation of us getting Delta variant 2.0, right? So I think there's an argument for it. So I'm all for it.
You know, and you have been all for it. One of the things, and one of the reasons I picked that article, that was the report from Washington Post, but there was an article following it up that I had picked from the Atlantic, in which basically the statement was, you should get a booster now, and America's booster rules are far more confusing than necessary. I picked that because this is a public health issue too. And why are the feds so far behind, and why do the states feel they have to jump out ahead? And it's just more confusing discussion and language that keeps people confused. And when people are confused, they often do the wrong thing. I would just quickly hit the point of this particular. It was more of a opinion piece from the Dean Brown School, the dean of the Brown University School of Public Health, in which he said the underlying challenge is that our public health infrastructure was designed for non-crisis situations. The FDA and CDC procedures prioritize slow, careful analysis of evidence only after companies formally submit their data. This makes a lot of sense when considering a new hair loss drug, but not during a fast-moving pandemic. And I won't read anymore, but it's that type of, I don't know, it's not incompetence, but it's not moving to what the reality is. And we've seen a lot of that, and I hope public health gets its act together, because people are losing faith.
I can't argue with you on that, but I can say that we did not know anything about this creature. It was called the novel coronavirus, right? True. And so we were learning in the trenches. We were learning as we went, and we had to make adjustments. I think where there was a huge fail in public health and even in the government, federal level, out of D.C., was that we had people who did not make the pivots when they should have, as the information became more robust. And honesty should have been the policy, right? As you learn the information,
Indeed.
and as you become more aware, and if you know better, you do better, right?
Don't get me on that.
Yeah. So I think that is where we lost the public, because the confusing messages as a result of people trying to tailor the scenario to get people to move in a certain way did not always line up with the science at the time.
That's right.
Yeah. So that's where I am with that.
And finally, for me, we're pre-taping this episode of Uncontrolled Substance. So by the time it airs, these two trials may be completely done, but I thought it was worth mentioning at this point in time, and this is November 19th, the defense attorneys for the Arbery death trial, the defense attorneys had rested their case on Thursday. They called just 7 witnesses, including the shooter, and it was amazing that they called the shooter. But he testified that Arbery did not threaten him in any way before he pointed his shotgun at the 25-year-old man. There are 2 big cases that are out there right now. This is one. It's worth putting out there. We talk about disparities in our community, the racism that's out there.
We talked about gun violence. About
so
policing. So this is right in the wheelhouse of what we focus on. 2
quick things. It was bizarre that the defense attorney made an issue of the Reverend Sharpton and Jackson being out there. And having the guy get up there and testify when he was, it just hurt him. But at the same time, I'm hoping, this looks like it's going to go the way common sense would have it go. I pray that's the case. I pray that justice is served in this case. The Rittenhouse case is the second case. I don't think it's going to go the way people would want it to go, the way common sense would have it go, because the law and common sense doesn't always go together. I'm just praying for no violence, no matter what comes of this, and I'm praying for justice for everyone.
From your mouth to God's ears. Really. So we're going to take a break, but when we come back in our next segment, we have guest Ms. Petra Niles from Alzheimer's Los Angeles Dementia Care Network, phenomenal woman. Just want to, pay some bills, but when she comes back, it'll give us an opportunity to dig deeper into the conversation at hand, which is the forgotten pandemic, Alzheimer's disease in the Black community.
Can't wait.
On Uncontrolled Substance with Dr. Cozzette and Mr. Noel Jones on the Real Urban Radio Network. Stay tuned.
Uncontrolled substance.
Hello, this is Pastor Melvin Jones
and Evangelist Linda Jones, inviting all of God's true believers to join us each and every Sunday at 7 a.m. Pacific Standard Time for the Top 10 Gospel Countdown.
We are blessed and honored to serve you with the best of the best in gospel music, as posted weekly on the Billboard Gospel Chart.
The Top 10 Gospel Countdown every Sunday at 7 a.m. Pacific Standard Time on the Real Urban Network app and realurbanradio.com.
Uncontrolled substance.
So welcome back to Uncontrolled Substance with Dr. Cozzette and my beloved Mr. Noel Jones.
I'm back.
Yes, we're so happy he's back in the studio. He's on the mend. Yes, and we're so excited about our guest who's in the studio with us on today, and this is Miss Petra Niles. She's a good friend of mine. She is the genuine article in this arena of Alzheimer's and dementia, and is boots on the ground, not, in the examination room like I am, but out there in the communities doing the work. In terms of just some background before we officially usher her into the examination room, Petra Niles is a gerontologist and senior manager of African American Services, Education, and Dementia Care Networks at Alzheimer's Los Angeles. She has been with the organization for 11 plus years and has an extensive background in aging issues, such as in the area of care management, elder abuse, program development, curriculum development, strategic partnerships, and the larger community. Petra currently provides ongoing education and outreach in the Los Angeles area, as well as implementing culturally specific workshops to the African American community in collaboration with faith-based institutions and other entities. Many of her efforts are focused on improving services to persons with dementia, their families, and caregivers, particularly through the West Central South Central Dementia Care Network, which she coordinates. By bringing together community members and professionals from various agencies, medical centers, and etc., Petra seeks to increase awareness of Alzheimer's disease and improve service delivery. She also believes strongly in the importance of motivating young people to better understand and become active in the fight against Alzheimer's disease, and provides leadership in the development of interest in the field of gerontology and neurology. Welcome, Ms. Petra Niles.
Welcome.
Thank you.
Hey, sweetie. We're so excited to have you on as our guest this month, this Alzheimer's Awareness Month, right? So
yes.
we want to drive home a particular message. And so let's just jump right into it, because I know, as always, we have so much we want to know, but not enough time to cover it all. So we'll do our best to try to do justice to this important subject. As we prepared for this show, Noel, my hubby, repeatedly commented, "This is a depressing subject." He said that over and over again. I was like, okay, I've heard it enough. He was depressing me. And most people would rather keep their heads in the sand and not talk about it until it's absolutely necessary, is his perception. And I think it's some truth to that.
I'm wondering why we don't hear so much about it, and it's under the cover, and I think that's part of the reason. But go on.
Yeah. So why is the subject of brain health and dementia important, especially for women and communities of color to talk about and to hear, more about?
Brain health is important for many reasons. As your husband said, we don't really think about the health of our brain. we talk about heart health, we talk about the health of other parts of the body, but as it relates to the brain, is something that is very, very important, and yet we don't speak about it. Brain health allows us, proper brain health allows us to be able to think and learn new things, remember, and we can function well in our everyday life and work. And so having the ability for language, attention, judgment, memories, it all comes from the brain and more. And so because we only get one, we really have to consider the health of our brain and how it allows us to be who we are.
Absolutely. So then narrowing the focus, why is this an important subject for us to hammer for the specific populations of women, and Black women in particular, and communities of color in general?
In communities of color, there are higher incidences of dementia and Alzheimer's, Alzheimer's being a type of dementia. So there are other dementias such as vascular dementia, Lewy bodies, mixed dementia, etc. And so it all occurs in the brain and affects memories and the ability to function and to be able to carry out your day-to-day activities. For women who are at high risk because of longevity and potentially genetics, heart health issues, cholesterol, diabetes, hypertension, and other areas of concern. And so in communities of color, we already know that there are higher incidences of blood sugar issues, so diabetes, hypertension, stroke, and those areas that affect the health of the brain. And so it's important to keep our brains healthy and maintain that by doing certain risk reduction activities.
Now, we know that we're in the midst of a pandemic still, one type of a pandemic, the COVID-19 pandemic, right? But we called this segment the forgotten pandemic. And I wanted to kind of bring the two worlds together, the twin-demic in this case being that of Alzheimer's dementia and COVID.
Yeah.
We mentioned how food and eating, social isolation, identity, support structures, finances, all those things during the COVID-19 pandemic have been impacted in communities already struggling to support individuals living with dementia. From your perspective, can you describe some of the ways this pandemic has disrupted the lives of patients living with the disease and their families?
As you were speaking, I was thinking about Alzheimer's disease as a pandemic being identified by Dr. Alois Alzheimer in 1906. This slow-moving pandemic affects 50 million people in the world and approximately 6 million here in the U.S. And so now the fast-moving pandemic, COVID-19, definitely has affected their communities. And so for those who are caring for someone with a diagnosis of Alzheimer's, already in the home with the person for long periods of time and not getting respite or some time off to be able to refresh themselves and continue the journey of caregiving, we're now even more isolated, limiting contacts with fewer family members, and that may have occurred because of the issue of being vaccinated or not vaccinated. There are a number of issues that came around as well. The limited technology. Those who are younger caregivers, I think, thrived as it relates to connecting their grandparents or parents with their physicians. But those who are older caregivers struggled with the telemedicine, telehealth approach. And so that the disruption of routines also for the person that they're caring for, and increased confusion about the pandemic, what's going on, the wearing of a mask, increasing, many caregivers mentioned increase in behaviors such as aggression, increased paranoia, and potential to wander was really high. And the lack of social and cognitive stimulation for that time really cause some issues in care.
I noticed it in the office myself, and it just broke my heart, where you have the fear that was attached to the unknown of the pandemic, especially early on,
Yes.
coupled with people who were already living day to day kind of in fear or anxiety, just as it relates to the disease itself. And
Yes.
fear of coming into the office translated into my inability to be able to give the full depth and breadth of care and treatment to our patients as a result of the pandemic and the fears that go with it. And then you have layered on top of that people who already have issues with dementia. So for me, it was really heartbreaking, especially in the first year, to have to I'd spent more time doing counseling, and trying to encourage and help, our patients during that part than treatment with medications or doing labs and things, because they weren't coming in. They were like, nope, not coming in. They were like, sorry, not coming out this house.
Yeah. And thank you for doing that, because I'm sure that was appreciated. I believe it was a time, and still is a time, to go above and beyond what we usually have done in the past, just to make sure that families are considered in every possible way, including if there are issues around food insecurity and other concerns.
I am glad, and I'm so glad we have you on. I'm glad we took the time to look at this particular subject in this episode, because I was just completely wrong-headed about it. We're juxtaposing Alzheimer's with this epidemic with the COVID pandemic. And I've looked at both diseases very differently. When COVID hit, I felt I had a lot of agency in determining how the disease would affect me and the family, even before the vaccines were available. I never stopped working. I went to the market and ran errands every day. And I didn't really fear it, because with the flu or with these respiratory diseases, I knew if I kept my distance, wore masks inside buildings, I would be pretty much okay. However, I've always approached Alzheimer's disease as if it was inevitable that some would get it, and getting it was maybe a roll of the dice. In other words, I never thought I had much say in the matter. Dr. Niles, why am I wrong to feel that I don't have a say in my future brain health?
Thank you for sharing that. And so many other individuals have the same perspective. But there are some things that we do have some control over. But first, let me share what we do not have control over, which is our age.
Okay.
We will get 1 year older every year. Gender and genetics. But we do have some control as it relates to what we eat, whether or not we exercise, reducing our risk for high blood pressure, blood sugar issues, and high cholesterol. And then it's important to have sleep, reduce our risk via stress. Wear your seatbelt, and be careful where you're walking so that you don't fall, because you could always hit your head and things can go from there. So there are some things that we can control.
I'm glad you said that. I'm glad you heard that, Noel.
Yes. I need to hear it. This is, like I said, this has been eye-opening for me. I am going to have better brain health and better control of myself in the future because of this episode.
Right. So switching gears a little bit, Petra, I wanted to talk about dementia-friendly communities, because I hear this term, right? I've heard, I was first introduced to this term actually outside of this country when I was attending the World Health Assembly back in 2018 in Geneva, Switzerland. And that's when I realized that this isn't just a U.S. issue. It's a global, issue. As far as the numbers being high, not just, within the United States. With dementia-friendly communities, though, I never associated it with the hood. You know, can you tell me, how does that look? How would that look in the hood?
How does that look? Thank you for being a part of our Dementia Care Network and dropping in when you can and meeting with interorganizational individuals from churches to Black women's organizations to sororities. This group of individuals who come together quarterly and talk about the delivery of services. What are the issues and concerns? And so, as you mentioned, yes, their European countries have had dementia-friendly communities for a while. But what does that look like in our community? The Dementia Care Network spoke mostly about having dementia-friendly neighborhoods. The neighborhoods is a space where they could start. When you talk community, it's so broad. But if we just focused on neighborhoods and just the street where you live, what that looks like is Mr. Jones down the street. We haven't seen him in a while, and he lives by himself. The lawn has not been trimmed. Something's going on. Do we know what's going on with him?
Right.
Has anybody gone over? Has anybody paid attention? Do you know his adult children or family members? Just simple things like that, contacting our neighbors, checking to see if someone actually is a caregiver on your block, on your street, and can you assist them in any way possible? And it may be as simple as letting them know about Alzheimer's Los Angeles, where they can call and get supported by care counselors and other services. So it starts in our own communities and potentially on our own streets by sharing information to community members, and it can grow from there. Places that you visit, the banks and local banks, restaurants, and so on, and potentially sharing with managers, especially if you notice that there's an older person and this person seemed to have a routine and they come to this restaurant every time you're there, they're there as well, and just trying, but you've noticed that something is not right. There may be some things that need to be checked out, and so just being a committee of one and sharing with that manager or whomever, there's an organization that helps families and individuals who are living with Alzheimer's disease or other dementias. So again, it goes back to helping out one another, neighbor to neighbor, friend to friend, and sharing information.
All righty. We want to pay the bills, so we're going to take a station break for a moment, but I do want to take you into the outro, as in the checkout and the prescription, so that we can ask a couple more questions that are actually empowering questions for our listeners and their families. Thank you, and hold on for one moment. We'll be back in a moment on Uncontrolled Substance with Dr. Cozzette on the Real Urban Radio Network. Stay tuned.
Uncontrolled Substance.
People with chronic pain will tell you, the hardest part isn't the pain itself. It's the way the pain steals your joy. For years, my husband lived with pain because we couldn't afford health insurance. Now, not only do we have insurance, I have him back too. Covered California is the only place to get financial help, and no one is turned away for a pre-existing condition. Enroll now at coveredca.com. Covered California. This way to health insurance.
Uncontrolled Substance. Uncontrolled Substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette and Mr. Noel Jones. We have our guest, Petra Niles. We want to continue into the checkout, the prescription. Petra, are you there?
I'm here.
All righty, sweetie. So, I wanted to have a couple of things, to leave out there for food for thought, to empower our listeners about their families and just some resources and things for them to consider if they ever find themselves in a situation where they need to reach out because they're caring for a loved one with dementia. How should families go about seeking outside help as far as hiring caregivers? Because that's scary, bringing a stranger into your house.
That's right.
Especially when your loved one can't remember everything or keep things straight.
That's right.
Already at baseline. And then you're bringing this outsider in who could potentially use that to their advantage and take advantage, of the family. What would you suggest in terms of, going for families because I really am for families reaching out and getting resources, and not doing it alone, because that's where burnout comes in and it's a slippery slope. What would you say to that?
Thank you for this question. It's very, very important. It's part of the planning and care as the disease progresses. They're at the beginning stages. Individuals may not need as much support as in the beginning. However, as the disease progresses and areas of care, more help is needed, it's important that in the decision-making process, the family comes together and decide about whether or not in-home care is feasible. Certainly, it may be an expensive venture. I believe the cost, the average cost of hiring someone in your home potentially is about $28 to $36 an hour. And so this really requires some thought and some planning. However, contacting Alzheimer's Los Angeles at 844-435-7259 to speak with a care counselor about your options and the ability to even give you insight into how do you actually hire someone, what are the questions that you should ask, and what are some things you should look for. So we are here to help in that way.
So Petra, one of the things that I should have been probably a little bit more clear up front, our listeners are across the country, not just in Los Angeles area. So where would you direct people to get information across the country?
In general, across the country, starting with the Area Agency on Aging. Mm-hmm. That's in every state, contacting them, and going from there. They will then put you in contact with a variety of resources in each person's particular area.
What are steps that family members can take when a loved one with dementia goes missing? Because we see the silver alerts, like the amber alerts here in California. What would be the action plan that you would suggest for families that they should make sure to have, available to themselves if this were to, God forbid, happen to them?
Be aware that if your loved one who has a diagnosis is ambulatory, that potentially they can wander. And so it's important to have a current photo and basic personal information like the height, weight, and ID markers, knowing their favorite place, making sure that the neighbors are aware that, sharing that information that your loved one has dementia, and if you see them walking by themselves, can you please alert family or try to redirect them home? It's important to also keep a family tree. There are some tracking devices that families are purchasing. However, they can sometimes be taken off.
Right.
In Los Angeles, we do have a Los Angeles Found, LA Found emergency contact, so calling 911 as well to get assistance. But there are some things that you can prepare, again, by having a current photo and basic information about your loved one. That's important.
Thank you. Now, as far as take-home messages that we want to leave our listeners with, because we wanted to, highlight this topic because it was National Alzheimer's Awareness Month, according to our current Commander-in-Chief, President Biden. But we also wanted to spotlight it because of its disproportionate impact on people of color, on African-American communities in particular, and the fact that I don't think we're really aware of this. I don't think the message is out there enough to the point where people say, I knew that. like they know that diabetes and obesity is out there, and heart disease, right?
Yes.
But you don't really hear much conversation around dementia in our communities, and it seems like almost taboo to even admit that you have it or that a loved one has it, and you kind of hide them in the back room, of your house, right? As opposed to, making it known and mobilizing your village. So what are some take-home messages that you want specifically to direct towards communities of color with regards to Alzheimer's dementia?
That it is a disease of the brain, and that the brain literally is changing, and there are the ability to think and to make decisions that will change, and to make sure that there is currently a lot of stigma around this disease. So to help destigmatize the disease, we have to talk about it more. We have to be able to trust that if someone on your street, if you or someone you know is caring for a person diagnosed with Alzheimer's or one of the other dementias, that you can share it, because it would be helpful in the long run, especially if they are ambulatory and strong and able to walk around and do things that they may assist at a time where it will be necessary. So just sharing that information could potentially avoid a serious matter. It is a part of, and to think of the brain, the brain, like the heart, is a vascular organ. And so all the things that we know about the heart, if you consider your heart health, you also are considering the health of your brain. And so let's start thinking again about the brain as an important part of what we need to take care of, because we only get one, and we have to really take care of it. Not just as adults, but certainly as younger people, and because younger people don't always make a lot of their decisions for health and what they eat and certain things like that. Families, as we're considering holiday time and the foods that we eat or don't eat, it's important to consider, is the food we're eating this next week, are the recipes brain healthy?
No.
That's the challenge.
Not the good stuff. No, I'm just kidding. I'm not
stepping on some landmines right there. But you know what? That's a great word. That's a great word in terms of families coming together and doing the right things, especially for their kids. So I appreciated that.
I think it's a good opportunity also at holiday time for families to kind of break down those walls, tear down those walls, and have this kind of conversation. What's the vision of the future for your loved ones? To talk about what does abundant living look like to you, because my definition of living may be different from someone else's. And for me, it's like pull the plug. I tell Noel all the time, do not linger with me, just let me go, right? But someone else may say, I don't care if I'm on a vent, if I can't speak, if I can't move, as long as my heart is pumping, leave me be, right? And then there's everything in between. And so I think holiday time is an opportunity for us to have a conversation and to dig into our family trees, as you mentioned up front. But it's also an opportunity to kind of change the direction, because this is actually disproportionately hitting our communities. We're only 13% of the population, right, in the U.S., but it's 20% of the cases are among African Americans. And the epidemic is coming as we age, as we live longer, because we have more, accessible to us to help us stay here longer, right? The downside of longevity is that you may lose brain, cells, the nerve damage that may happen that leads to the manifestation of dementia. So this, to me, I look at it as a not just as a health issue, but also as a health justice issue. Because I believe that African Americans are disproportionately represented and go through a much more challenging course because they're not being identified early on. because they're not even being screened, or even not even just early on ever. It's about 50% of the cases are not even diagnosed across all racial groups, and it's worse among our group, among African Americans. And so what would you say to the racial side, the racialization of this, the healthcare disparities and racism being at the root of that, as far as, the late discovery of disease in our people?
Yeah, thank you for sharing that. Unfortunately, yes, African Americans are twice as likely to have a diagnosis than any other groups as compared to whites, however, are also diagnosed later in the disease. I remember many years ago thinking about, in discussion in our community, and I asked a question. I asked, has anyone seen or heard from someone who has a diagnosis of Alzheimer's disease in early stage, meaning that they have been diagnosed early enough that they know that they have this disease and are in the process, along with their families, of planning their care, what they identify in wishes, and planning for the future. And so nobody could. And I don't know that we have, that everybody has seen someone or have heard of someone who has been diagnosed in early stage. And so sometimes this is all that comes about because of the misdiagnoses. It comes about because some things are dismissed as old age. Some things are just, some of the symptoms are dismissed, and so the diagnosis doesn't come until the person or a family member takes an individual into the doctor, and then there comes the diagnosis. So it's important to understand that the signs of managing finances and paying bills, misplacing things often, and cannot retrace the tracks of where they place something, change in mood, trouble with reading, writing, and conversations, repeating stories and questions. These are some of the signs that should make family members aware that something is going on, and there needs to be a workup to see what it is. Also, getting lost in familiar places. You've lived in a place for 40 years, and while going to the store a block away, you cannot remember how to get back. So these are some things to pay attention to.
Maybe I need to go get tested. No, I'm just kidding. I think I get tired sometime, and I get forgetful, but I think it's important for people to make a distinction. I know when people come into the office and they say, I think I have, dementia, I think I have Alzheimer's, I point out the fact that you're coming in and saying this to me decreases the likelihood that that's the issue, because typically the insight is poor, on the side of the person that really, truly has impairments in that area. So this was wonderful. Noel, did you have any?
Well, the only thing I wanted to say was having those conversations early, that would be a sea change, We do, I think, though, have a vehicle right now to start talking about them, because start talking about dementia. And the only reason I say that is because I've been hearing more and more about brain health in the news. It hasn't been about dementia. It hasn't really been about dementia, but it has been about concussions in the NFL. It's been about Britney Spears and her conservatorship and the reasons behind it initially, and her overcoming that. So if we can start piggybacking on those other brain health issues and start talking about Alzheimer's and other dementias within our own families, that would be wonderful. Especially early, those early conversations where you plan things out before moderate or severe dementia comes upon you.
Absolutely. And there was a NFL player that was on the panel recently for Alzheimer's Association. Lomas Brown?
Lomas Brown.
Is that his name? That's it, right? Yeah. He was awesome. And he's doing exactly what you just suggested, Noel. He's piggybacking on the traumatic brain injuries that happen to NFL players, and being a champion in the space of Alzheimer's dementia as a part of that whole spectrum of brain health and things that can go left when you don't take care of the brain. But thank you so much for bringing that up, because that's a great point. Yeah. It's a shout out to him for the work that he's doing and using the platform that he has to get the word out. Thank you so much, Petra, for coming on.
And thank you for what you're doing as a primary physician who recognizes the importance of brain health, how critical it is to be able to reduce the risks, certain risk factors, and to be able to identify certain things so that families become aware ahead of time. And so as a primary physician, again, you're doing an amazing job so that, and even as it relates to doing a referral to a neurologist or someone for a more intense workup.
Right.
So thank you.
Thank you, absolutely. And thank you, everyone, for tuning in to Uncontrolled Substance with Dr. Cozzette and Mr. Noel Jones. Happy holidays. And
happy holidays. Hope you had a great Thanksgiving.
Yeah, and stay safe out there, in the midst of this pandemic. It's still going on, so don't let your guard down because it's holiday season. Still be safe, but enjoy and savor, with gratitude, the moments that you have with your loved ones. Thank you, and God bless. Tune in on the fourth Sunday of every month, Real Urban Radio Network, for Uncontrolled Substance. Thank you.
Thank you.